if you were living in rural Virginia in the middle of the 1960s and you were poor, access to health care was very difficult. And it was particularly difficult if you were an African American. The woman who was our founder, Beulah Wiley, was a community activist, and one of the things that she did was that she helped take people to UVA in Charlottesville, to the medical center there, because nobody between Cumberland County and Charlottesville would take low-income uninsured individuals or people who couldn't pay.
One day she came in and sat down and said, "It's really unfortunate that we have to take over an hour to get our kids to the doctors in basically the Buckingham, Fluvanna, Cumberland community, that there was no easy way to get to Richmond or to get to Charlottesville to UVA." And so she said, "We need to have doctors here in town." So she took it upon herself to start. She had heard about the community health center movement and decided that she was going to try and get one here.
There were no community health centers at the time in Virginia, and so she literally went door to door and said, "Will you support the establishment of a community health center?" And she got some blowback, but she found a dedicated group of people who said, "Yep, this is what we want, this is how we're going to go about it."
I remember I attended the second meeting concerning the establishment of this health center. I was invited to a meeting by Ms. Wiley, and we were really raked over the coals about this building, about this facility. And the concern was the federal government was going to put this building here and would go off and leave it, and would require Buckingham to pick up the tab for everything, and my taxes would go up. And we were asked, "Can you guarantee me that's not going to happen?" Of course, we couldn't. You know? Ron told me we can't do that today. But anyway, one day we did see construction start, and we had no idea what it would be later on.
One of our patients at Central Virginia owned a hunting lodge that he let them meet in, and they pulled together the organization. They got their grant application together, sent it away, and it got funded. Originally, it was Central Virginia Health Services serving Cumberland, Fluvanna, and Buckingham County, and they had a trailer that was in each of those three different counties. That was not a cost-effective way to run the organization, so they pulled the trailers to one place in Gold Hill, which is where the current organization is located.
We started out with trailers. We had dental, who was in a trailer, and then we had like our medical staff in a trailer. And then I'll say we had our clerical people, which I would say that was what I fell under. But no, I do not miss the trailers.
Ms. Wiley ended up becoming the first executive director of Central Virginia. As the years went on, there was a growing recognition that we had a vital role to play in the community and we weren't stealing business from anybody else in the county.
You were able to get good health care here. You know, we had good providers, and it just made it available because we were picking up patients. We had family health workers who went out into the home. Kids were able to get immunizations. I mean, it was just a whole new ball game, just a whole new ball game.
Beulah M. Wiley did a great job of fostering the concept that this is a community-based organization for the community to benefit the community. And I think everyone after that maintained that same model. Cephas Goldman was a dentist who became one of our executive directors. He then went on to HRSA level, so he definitely had the foresight of what we needed to do and grow. He had the distinction of hiring my predecessor, Rod Manifold.
Cephas was with us till '92 and had been grooming Rod Manifold to then, take his position. And Rod actually had started 2 months after I did. They hired him as a bookkeeper. Went from being the bookkeeper to the CFO to the executive director, and did a great job then of leading us from 1992 until his death, a year ago.
He passed away unexpectedly, and so definitely keeping everyone together was a challenge of stabilizing us because we had to have a grieving process, but we had to keep going. I forget how we came around to it, but somehow we were asking for, I guess, thoughts about Rod or common threads, and somebody said, I'll never forget, every time he would leave a site, and we often said he'd leave a meeting too, his line was, carry on, people, carry on. And that became sort of the line to get through the challenge, and we've adopted it in doing a tribute to him through a pharmacy fund. And we've had kind of a fun run every year for National Community Health Center Week since his passing to raise money for that fund. He definitely saw the need and responded to it across the state. He was not afraid to address opportunities if there was a community needed in our help, and truly made the name Central Virginia Health Services mean that large group of areas.
So as far as like growth of Central Virginia, so we had here, and then we had the Women's Health Center, and then there was a practice over in Esmont, which was a small community health center.
There was not the financial support there to keep the center as an independent center. So Central Virginia came in, offered us a way out, and even though it was an offering, it was not well received. Rod Manifold was instrumental in getting the community to sign over the center. He was also instrumental in being out at the center and getting to know the people in the community and ensuring that they knew that they could trust that he wasn't doing anything that was going to cause this center to not have what it needed. And it took him quite a few years to be able to build those relationships. And once he was able to establish and build the relationships, you could see the community coming around and people getting back to feeling like the center still belonged to the community, just under different leadership.
We had a situation down in Alberta where that practice was going to get defunded, the Southside Health Center, and so we swooped in. And then in Charlotte Primary Care, they were a private practice that was trying to make it in the world and could not survive. And they had a great group of practitioners there, and so we merged with them and they became part of us. And then they started having, grant opportunities and stuff during the second Bush administrations. And so we got Petersburg.
I was very concerned that we would not be able to sustain the level of funding that had gotten us up and started. And so I started looking for partners, and I turned to the association and said, who can I talk to that might be interested in having us merge with them? And they said, well, there's this guy, Rod Manifold, you might go out and talk to him, he's done this before. In the end, we decided that we would write an application to HRSA to start us as a community health center. Lo and behold, the grant got funded and we merged with Central Virginia Health Services.
We did an expansion over into the Appomattox, the other one in Petersburg. We had to practice one day a week in the health department in Hopewell, Prince George, and we got the opportunity to make that a whole nother practice. We had Tri-County Medical Center. Their CEO was retiring, and so they wanted to merge with us. And so that was the King William, Dawn, and Westmoreland Medical Centers then. And then after that, with Charles City, we did a grant for that one. Then we had a whole bunch of grants, pretty quickly together. Louisa, Fredericksburg, Neighborhood Family Health Center. And then with that one, we actually had to do a new site because the Region 10, which is the CSB, had this grant to do an integrated program and stuff. And so we put one of our practitioners over there, so that now that's one of our practice sites. And then we put Caroline in, but then also Caroline Dental became another one of our practice sites.
In the late 90s, UVA had done a study around the New Canton site, our flagship site, and they found that there was a very high level of depression among rural women. And at that time, a grant was written to hire a behavioral health provider at the New Canton site. So there was a position for a psychologist. After the grant ended, CVHS decided to continue behavioral health because they saw the need, so they continued to employ the psychologist that was there at the time. So CVHS was the very first health center in the state to have behavioral health, and that was the beginning.
Rod was very confident in the ability of our organization to meet the needs of communities. We had a really good infrastructure model that allowed us to manage these sites and still help them feel like the decision-making and service was being delivered in the community, and I think it's what really helped us to grow. And again, he was great at hiring people who knew how to do their job. He had a great leadership team with him, with our clinical director, Dr. Randall Bayshore, and our CFO, Charles Albaugh, really led the group in maintaining our finances and building a clinical infrastructure that could really take on that challenge. When I started in 2001, we have doubled in size in the years that I have been there. I have seen the growth of that organization, and it's been because he made good decisions on hiring a development director in Sheena McKenzie, who had a history in Community Health Center. So his visionary leadership as far as what we could do as an organization, what he could get out of his employees, and we were all willing to follow him because he really believed in this model of healthcare. We've tossed around this idea a lot, and we've actually decided that we are going to rename all the sites under one name, and we're going to use just the acronym CVHS.
We want to try to be as unified as possible as an organization. Whether you're at Central Virginia or you're at Neighborhood Family, all the centers have the same goal and objective. This branding, we hope, will help have the community see us as one entity, even though we're at different locations.
We have a lot of patients who don't realize, because of all the community-based names, that we're part of the same organization. To stick to our roots and our history of Central Virginia Health Services, and we don't want to lose any of that history and the great work that we've done, we decided, since everybody calls us CVHS anyway, to just use that name so we still have the recognition of who we were, but hopefully it'll help us build for the future.
I think Ms. Wiley would be amazed that Central Virginia today has 17 locations and served over 43,000 patients last year and grew into a large healthcare provider across Central Virginia. We serve 19 localities, 4 cities and 15 counties. We have about 380 employees, which is a pretty significant labor pool.
It started out in 3 trailers, and it has grown to now be medical, dental, pharmacy, x-ray, and it's a huge campus. Sometimes the older health centers, it's less understood what we do because there's this idea that the only person that go to a health center is someone who doesn't have insurance. And the fact of the matter is, anybody can come. We're in our communities because there's a need for care.